What's up, everybody? It's David, host of Highway to Health podcast series. Thank you for being here. If you've tuned into previous episodes, you know it's a passion of mine to bring on experts around the healthcare industry. And we discuss how we're making improvements to the access to healthcare, the experience while getting that healthcare, and then obviously the outcomes for our patient and provider communities. And you're going to like who we have on the show today. He's the Chief Commercial Officer at Health Catalyst. And Health Catalyst is an outcomes improvement company. So it's a perfect time, perfect guest, and you're going to love this episode. Kevin Freeman, welcome to Highway to Health.
Thanks for having me.
Yeah, thank you for being here.
Great.
We got the good studio today.
This is awesome. Yeah, I'm a Dallas guy, so seeing Dallas and the skyline is great.
Well, only the best for you. We're going to get started in a minute. It's a tradition of mine. It's one of my favorite questions to ask our executives is the healthy habits, mentally and physically, that they've built into their daily routine. You're a busy guy, like we all are, but a priority, a responsibility of ours is to perform at a high level for those that depend on us. So what have you done to implement a routine that works for you?
Yeah, it's a great question. And being busy is often the excuse, right? To trying to focus on yourself. And I think focusing on yourself is the most important part of being really good at what you do with whatever that is. We have a saying at Health Catalyst, at least in our group, you, family, work are the three core values that we try to live by. And you're be good for you and take care of you. Mental, health's a real thing, and
yep.
Make sure you're taking care of that. When you're good for you, you're good for your family. Then you're really good at work, and it should be in that order. Prioritize. So we try to prioritize, at least in our group, just the family kind of centered focus and whatever's important to our team members. Outside of just me personally, the gym. I get up every morning when I can. I'd say 5 to 6 days a week when I'm at home, and get in the gym. And I've got my routine of getting to Lifetime Fitness early, maybe hitting a couple emails, getting the gym in. It clears my head. It's a stress reliever for me.
100%.
Lets me work on me before we focus on the team members. And like I said, focus on you first before anything else is the most important part, whether it's physical health or mental health, or that's all important. It's important to our family too. We were pretty healthy family.
Good.
So they keep me checked up, keep me in line.
They will, man. They'll keep you accountable. But it's almost like when you're on the plane and they tell you to put your mask on first before you help anybody else with their oxygen mask, because if you're not there, you can't help anybody else. And
that's right.
Our health has to be the same way, where we have to take care of ourselves so that we can take care of others. So I like that. You, family, work. That's a good thing to live by. All right, you've been in healthcare a long time. I'm going to say a long time.
Yeah, don't put the years out. Just say
okay?
long time. Long time covers it fine.
All right. A decently medium level time you've been in healthcare.
More than others, and
less than
some.
Yeah. 100%. But that leads to some great experience. And how does this experience pay off for your providers, even you yourself, but also Health Catalyst? This crazy industry that we're in, it changes all the time. How do you lean on that experience?
Yeah, it's healthcare is a moving target. So I think experience matters from the perspective of understanding that that's a real thing. Yeah. That not going in expecting things to be the same. Meeting with clients on a quarterly basis is important to understand what those things are, and being really good listeners. So I think being a good listener almost beats experience when you're working with clients.
Yeah.
It's important to listen, but it's also important to kind of internalize and understand what they're going through, so that you can shift your strategy or upgrade your strategy from year to year to stay in line with what they're working against.
Yeah, I mean, anticipation's a big thing, where not that you can guess or predict what's going to happen next, but anticipating that something is going to happen, and then listening intently to understand what those challenges are. I bet you walk into a meeting sometimes with an idea and it is completely different by the time you walk out.
It is, yeah, or it needs to be adjusted, right? It may not be completely different, but it may be a little bit different, where we say at Health Catalyst we want to be data informed. We're a data company, and in a lot of the decisions we make, we like to lean in on being data informed. We try to be data informed when we get there, but we also try to be really good listeners when we get there, and not have a 100% confirmed hypothesis and try to drive the meeting, but be good listeners. Health Catalyst, our experience of being in healthcare and within healthcare data for 15 plus years and having over 300 use cases of outcomes improvement that we've been able to deliver to healthcare puts us in a unique position to listen, right? So when we listen, we can apply those 300 use cases often to say, we've had other clients with, similar things that they've tried to work against, and this is how we helped them.
Yeah, history of delivery.
Right.
Delivering
History
on those
delivery.
challenges.
Yeah, delivering value.
Right.
Right. When you think about clients and keeping clients long term, you always hear people say if clients like you, they'll stay with you.
Yeah.
And it's not true, right? They can like you, but if you're not providing value and they have so much money to spend, they may like you and they may still like you when you're not partners, but you have to deliver value in order to keep that partnership in place.
Especially in healthcare, because that bucket of money that you just talked about isn't very big and it's shrinking all the time.
It shrinks all the time, and there's got to be some sort of return on investment, and they have to answer for the money that they spend just like any other business. So how do we add value and make sure that, we need to articulate that value better, and that's what we're trying to do as an organization, is not leave the health system out there to say, what is Health Catalyst doing for me, or what are my other vendors doing for me? We're bringing that value to them to say, hey, over the last quarter,
right,
over the last 6 months, over the last year, this is what we've done. Here's some data that says, here's what we should work on next. Let's talk about it.
Yep, that's cool. Kind of driving to a solution, not with a solution, where based on data, here's what we know, and it highlights some challenges or some obstacles that you might be anticipating. I think, I touched on this experience topic and this history of delivery because you guys are in a space, Health Catalyst is in a space right now, which is growing in popularity and gaining a lot of interest from all kinds of companies that aren't natively healthcare based or healthcare focused, but notable names. Call it big tech, call it enterprise tech, call it whatever you want. But there's been an elevated level of focus and interest in this space. And I would anticipate that your experience, your history of delivery might give you an opportunity to differentiate. How does that experience help you position yourself and Health Catalyst when dealing with some of these huge names that might be more familiar to the average provider?
Yeah, that's a great question, and we love more vendors and more big tech coming into healthcare because we're a mission-driven organization. We're really in it to drive healthcare forward, and that means more vendors and more ideas. The more ideas, the better. We do wake up every day, and this is all we do. Like, we're a healthcare company. We have data to back up our ability to add value to help clients, move the ball forward. It's a interesting space now because with all the tech coming in, I think the messaging gets a little cloudy, and people are trying to really figure out what is Microsoft doing, what's Snowflake doing, what's Databricks doing. All great companies, all great partners of ours. But then how do we combine the best of breed technologies across Health Catalyst and all these other vendors? I love the saying better together. I think there's a better together story between us and other big tech vendors. Our expertise of being in data, expertise of the healthcare data model for 15 years and helping clients achieve outcomes improvement. I love going to shows because if somebody comes by my booth, they'll say, "What are you doing?" I'm not going to say data analytics because you probably went to 50 booths already. That just said that to you.
That and AI. Yeah.
That and AI. Yeah. But I love to talk to people about data just being data, right? So if you surface data, that's great. But if you don't have the data literacy and the wrapper of healthcare improvement to put that data to work, it's just data.
Right.
So how do we teach our clients, educate them from a data literacy perspective to take that data throughout the organization and solve multiple use cases?
Yeah, that's a stance of strength because if you listen to Elon, if you ask Elon Musk about these new vendors, manufacturers of electric vehicles, he'll say something similar. Good, that's great. We need more advancement. We need more ideas. And I trust that Tesla will be the strongest, the leader, the authority in this space. And so when I hear him say that, it sounds very similar to how you discuss, these new ideas that are coming into outcome improvement and data literacy because, look, this isn't a new bag for Health Catalyst. Y'all been doing it a long time.
Yeah, we have. Yeah, and we love our partners, and with the new platform Ignite that we just released, this past year, we want to go in and take those best of breed technologies, any investments that healthcare or our clients have made, and not do a rip and replace. We want to build upon that. We want to build upon those investments, and how do we work with those other investments to drive value quicker for your organization?
Well, and I think that would probably lead to some positive flexibility in your solution. Because if you're going in and trying to rip everything out so that you can bring in your solution instead of playing nice with others and having good partners, that might put a limit on how quickly you can drive value. It might put a limit on who you can drive value with. How important is being a flexible solution to Health Catalyst and the providers you work with?
It's super important, especially even more so, I think, in healthcare, as they've made investments. They're in contracts, they have partners, they have relationships that they've established with other vendors. The more we can take those investments, not throw them out, and partner with them, figure out what's working about that investment. Is there a 1 + 1 = 3 between Health Catalyst and that investment that you have? Let's talk about how we make it that better together message. Is there a better together message when we get there?
Yeah.
I do think our expertise coming in and actually putting the data to work is unique to us. It helps drive value to our clients, not just from a one project, or it could be one project, could be one solution. It could be 5 or 6 solutions that Health Catalyst provides across an enterprise. But adding value for not just 1 year, but we have some clients that have been partners for 10+ years. And we're always working with them and sitting down with them to see how we can continue to move the ball forward with them.
They wouldn't be there either if they were unsure of the return or the value that you were bringing. So that's a really, really strong sign. And flexible solution, I think of, these providers that, I've experienced with in my past. They're all at a different stage of their journey. Some of them are more forward-thinking, innovative, mature digitally, and others are at the other end of the spectrum just because of the nature of the business. I would imagine a flexible solution would help you meet those providers wherever they are in their digital maturation journey.
Yeah, I think the flexible solution does for sure. With Ignite, so initially, our investment on the tech stack side was pretty heavy from a professional services perspective. We've shifted that model to where if a client wants to build their own on our stack, they can. If they want more project-based work, we can do that. We're there to help and assist. And I think that's a key part, is the tech's the tech. So having the tech in or having a flexible solution is awesome, but having the experience to actually drive value over 15 years with 300+ use cases and multiple clients, sitting down with them and understanding where they're at in their journey, we've got that experience and expertise to help them along that, wherever they sit in that, whatever that journey looks like.
Is there a data literacy void in the provider community?
Yeah, I think so. And I think there's a lot of really smart people in healthcare.
Yeah.
Right. They're just one of the great things about working in healthcare. We have a lot of smart clients, but they're busy on lots of things.
Yeah, amen.
Right. So we want to be able to help them take that data and push it throughout the organization and teach that data literacy throughout the entire organization. That's a lot for them to pick up and try to do.
Sure.
At Health Catalyst University, we do that for them.
Okay.
So we'll bring in any stakeholder with the data, because data is data, right? So if so-and-so's got data, what are they going to do with it when they get it? How do they look at it and really understand it and the complexities of it? We're there to help them learn that. And the more stakeholders that are data literate inside the organization, the more value they're going to get from their data strategy.
Tell me a little bit more about Health Catalyst University.
Health Catalyst University is amazing, and we partner with clients all over the country on lots of things, whether it be initial, I'm just getting into data. I don't know anything about it. I don't even know how to drive a car, kind of thing, right? I don't know how to drive data. So walk me through the initial steps. What should I be focused on first? So way down here, all the way to, I'm pretty good with it, but I want to enhance, I want to be better. How do I drive it even more forward? And so we have, through the university, we use Amplifier to go and give tests, and they're really tough tests. We take them internally sometimes. That's like chutes and ladders. You get a score wrong, it takes you backwards, and it takes you hours so you don't get to get out of that test without understanding data. It will not let you do it. And I think having that rigor, and we identify, we sit down with clients and try to identify areas of where they could use some help, or their curriculums we can help build for them.
Yeah.
Right, externally, that we've got our own internal curriculums to help, but if there's curriculums they want us to help build for them, we can do that too.
I think education is probably one of the most, call it an enablement education, whatever you want to call it. Oftentimes we get lost in this solution mindset, and that's what we're discussing. That's what we're talking about. We're using that kind of jargon. There's a problem here that is disconnected to that solution, and sometimes we're speaking different languages. Education's got to be at the core of what we're doing in healthcare, especially when we're a solution.
100%. Yeah, and it's the education, like we talked about earlier, whether it's learning data and what's important and what I should be looking at. But I think education just in general as people is, what am I doing now that I need to stop doing? Right? So what are you learning through all of the work that you're doing that, hey, this is working, this isn't, we only have so many cycles.
Right. So
applying learnings is also super important.
Also learning, where we can save time. What's not working?
What's not working? Let's stop doing that.
And then you can double down where it matters. So when I hear flexibility, when I hear education, when I hear these things, you can't do this as a company unless you have a really strong idea on what your mission is, and then being driven by that mission. You've said mission driven a lot. What does that mean to you personally?
Well, it means a lot to me, and I've been in healthcare now for a long time. I'm not going to say years like we talked about, and healthcare is a special place. I mean, if you're just as a person, right? Healthcare is important to us as people, and the patient is important. And we had a company, VitaWare, that we sold to Health Catalyst in September 2020. And so we're fortunate enough to get into the Health Catalyst family, and getting there just in the very beginning and listening to Dan Burton, our CEO, and it just was this nice, positive, supportive, team member focused place, and mission driven. Like, we talk about the patient being important, and the mission of the patient being important, and how do we as a company help pull the cost and waste out of healthcare that drives that expensive healthcare price to patients, right? And that the cost structure is still something that healthcare struggles with, and
100%.
A bunch of our clients struggle with, and we try to help with identifying those areas we can help improve that. But we wake up as everyday healthcare-driven, mission-centered people, and we build our teams around that. We want team members that are mission-driven, because when you sit in front of a client, and I honestly believe healthcare people who work in healthcare, or people who work at our clients, are mission-driven people.
100%.
Right? They're in it for the mission. And
there are easier things they could be doing.
There's easier things they could be doing.
Healthcare is hard. More money somewhere
Healthcare is hard. Yeah, there's a lot. It's hard, but I also think that it's important.
Yeah.
Right. And they wake up every day and they're like, "This is important to me." You feel good about going to work. That's how I feel about healthcare. When I get up every day and I go work on myself, right, my body and physical, all the things in healthcare, just being available for every human being, whatever that looks like, it's important. So that's what it means to me.
Yeah, access to that care experience.
Access to care.
And then outcomes. And none of those things are possible if this cost structure doesn't get under control. We have to eliminate a lot of the waste and the mismanagement to get there, to get where we want to go.
Yeah, we got a lot of smart people on it. We got smart people with the client. We got smart people in the partner world or vendor world with Health Catalyst and all the other vendors. But it's learning and applying and really digging into where do we start and what does outcomes improvement look like for me as a healthcare organization.
Yeah, and keeping that front of mind makes data more than just data. Right. It's a means to an end, which is getting the patients what they need by helping the provider be more efficient.
That's right.
What's the one thing you want our listeners walking away understanding? If they could take one thing away from today.
One thing away from today. I think the one thing that, all the work we do in healthcare is important, whether you're on the partner side or the client side. And I'm a mission-driven guy. Our organization's mission-driven. The more we work together across all vendor partners, all organizations, consulting companies, competition's good, Competition makes everybody better.
Yeah.
There are better together stories in some of this, and how we can, help move healthcare to that place where, cost management becomes better, those types of things. But yeah, it'd probably be that we're Health Catalyst, and me personally, mission driven. We love what we do. We love our clients. We love the work that they do. We love to participate. We know we can be better. We wake up trying to be better every single day, and we'd love to hear feedback on how we can be better from our clients, which they're great about giving to us. But yeah, I love healthcare. I love the mission. I love the people. Love our team. It's exciting.
You reminded me of something I heard at, I think it was Vive earlier this year. The Philips CEO got on stage, and at that time he was brand new. And he's standing in front of hundreds of people, exhibitors that have the newest, shiniest solution. They're there to evangelize about how they can disrupt and change healthcare. And the first words out of his mouth were, "None of y'all are going to change healthcare." And he just let it sit. And he goes, "Because none of y'all want to talk to each other. None of y'all want to work together." And you know what? He's right. And coming from, what I've learned from you today is there's a better together approach. There's a need for flexibility. And let's collaborate. Let's work together. Let's be flexible. And then let's educate you along the way. And maybe we can get there one day.
Absolutely. Yeah, 100% agree. And it's the better together story benefits clients.
Yeah.
Right. So
which benefits the patient.
Clarity is important, and all of us delivering that clarity in our message with our clients and our meetings with our clients is critical to path forward.
Thank you for being here.
Thanks for having me. This was great.
Yeah, this was fun. We'll have you back.
All right. Appreciate it.
Thanks.